Hormone imbalances can disrupt your daily life, causing fatigue, mood swings, and more. These imbalances affect millions of women, especially during perimenopause and menopause. Understanding their impact is the first step to reclaiming your well-being. Balancing your hormones involves identifying and correcting imbalances with bioidentical hormones, supplements, and lifestyle changes. This personalized approach can alleviate symptoms and improve your quality of life. How do you even know what hormones need balancing? Symptoms like weight gain, hot flashes, and mood swings might be signs. Identifying these early can help you take control and seek the right treatment. Bioidentical hormones are derived from plants and mimic the hormones your body naturally produces. Unlike synthetic hormones, they align closely with your body's chemistry, offering a more natural treatment option. The benefits of bioidentical hormones include regulating menstrual cycles, alleviating menopausal symptoms, and boosting energy levels. They can also support bone health and improve mood stability. Safety is a common concern. Research shows that bioidentical hormones are effective and have a better safety profile than synthetic options. It's also important to note that hormone therapy is not as simple as being prescribed a patch and a pill. It takes careful monitoring and ongoing adjustments to get your hormones balanced precisely for your body. Every body is different and responds in a unique way to hormone replacement. It's important that you always consult with a trained provider to ensure safe use of hormone therapy. Starting a hormone balancing journey is not about chasing a single lab value or prescribing a one-size-fits-all solution. It starts with listening. Every woman's experience of perimenopause and menopause is different, which is why our first step is always a conversation, not a prescription. During our free discovery calls, we take time to review symptoms, patterns, and lived experiences so we can understand what's really happening in the body, not just what looks normal on paper. Hormonal shifts can affect nearly every system in the body, which is why our assessment is intentionally comprehensive. Here's what we review together during a discovery call. Vasomotor symptoms. These are often the most recognized menopause symptoms, but they're only part of the picture. Hot flashes, night sweats, sleep, and fatigue. Next, we look at sleep. We know that hormonal changes can significantly disrupt sleep architecture and recovery. Persistent fatigue, difficulty falling or staying asleep, and non-restorative sleep is very common in perimenopause and menopause. Then, we look at changes in mood and your emotions. Hormones play a powerful role in brain chemistry and nervous system regulation. We often see symptoms like mood swings, irritability, anxiety, low mood or depression, emotional sensitivity or reactivity, and panic attacks. Again, these are all classic symptoms of fluctuating hormones. Hormones also greatly impact our brain chemistry, and this can show up in the form of memory lapses and difficulty concentrating or brain fog. Women often report experiencing forgetfulness and overall mental exhaustion during perimenopause into menopause, all of which can reflect a state of estrogen deficiency and other hormonal imbalance. Reproductive and menstrual changes. Even subtle changes in cycles can offer important clues to a woman's hormone imbalance. Irregular periods, heavy or prolonged bleeding, loss of libido, vaginal dryness, breast tenderness, brown spotting before or after your period. Next, let's talk about cardiovascular and circulatory symptoms. Fluctuating hormones can influence vascular tone and heart rhythm. This can look like heart palpitations or butterfly flutters in your throat area, dizziness, vertigo, and even lightheadedness. Changes to our musculoskeletal system and overall bone health are an often overlooked symptom of hormone imbalance. Estrogen and other hormones play a critical role in joint, muscle, and bone integrity. Imbalance can show up as joint pain or stiffness, aching muscles, bone density loss or new diagnosis of osteopenia or osteoporosis. A sometime obvious but less talked about impact of hormone changes show up in our skin, hair, and nails. In fact, the skin is one of the first places hormonal shifts show up. New wrinkles, less volume, and a dull complexion are ways hormone deficiency impacts the skin. And equally distressing can be hair thinning or hair loss. Women often wonder what is happening to them when strands of hair start falling out with each brush of the hair. Other irritating changes are itchy or sensitive skin, changes in skin texture or elasticity, and brittle or weak nails. Urinary and bladder health often are explained away as a sign of aging, but the truth is that pelvic tissues are highly hormone responsive. When we don't have enough of the hormones we need, it can show up as bladder weakness, urinary leakage or incontinence, recurrent urinary tract infections or cystitis, all of which can be supported and sometimes fully restored with the right bioidentical hormone treatments. Digestive and metabolic changes often catch perimenopausal women off guard. Hormones influence metabolism, gut motility, and insulin sensitivity. When our hormones get out of balance, suddenly or over time we can experience weight gain or difficulty losing weight, bloating, nausea, digestive discomfort or irregularity, GERD or reflux symptoms. So many women are immediately put on medications to temper the symptoms of these conditions, while ignoring the root cause, which may originate from estrogen deficiency. Our head, ears, and neurological symptoms are also greatly influenced by hormonal shifts, and unfortunately, neurological symptoms are commonly overlooked as a sign of hormone imbalance. These hormone imbalances can show up as headaches or migraines, tinnitus, ringing in the ears, vertigo, blocked ears, and more. Lastly, when autoimmune or inflammatory conditions seemingly arise out of nowhere in women, these are big red flags of hormone imbalance. Hormonal shifts can sometimes unmask or worsen inflammatory and autoimmune conditions. Some examples of how they might show up are flares of Hashimoto's thyroiditis, worsening psoriasis or eczema, rheumatoid arthritis exacerbations, increased gut permeability, systemic inflammation as seen in an HS-CRP blood test, and more. Why this matters. Many women are told their labs are normal, yet they feel anything but. By reviewing symptoms system by system, we can identify patterns, understand timing and triggers, decide what testing is appropriate, determine whether hormone support, lifestyle shifts, or deeper investigation is needed. This process ensures that when we move forward, we do so intentionally, safely, and collaboratively, always respecting the individual behind the symptoms. How we use testing to personalize care. Hormone testing is a core tool we use to guide treatment, but we always interpret labs in the context of symptoms. Blood work categories we assess and report on include sex hormones, thyroid function, adrenal and stress markers, metabolic health, inflammation and immune markers, and key nutrient status. For many clients, we also request a 4-point diurnal cortisol test to understand daily stress patterns, as cortisol directly impacts hormone balance, sleep, mood, metabolism, and progesterone tolerance. When symptoms persist despite appropriate hormone dosing, lifestyle support, and nutraceutical care, we have access to advanced hormone and gut testing to uncover hidden barriers such as impaired hormone metabolism, inflammation, or gut dysfunction. The goal: move beyond normal labs and create truly personalized, responsive care. Bioidentical hormones come in various forms, including creams, patches, and injections. Each form has its advantages, and your provider will recommend the best option for your needs. Cost and insurance coverage can vary based on the medication and the individual plan. Many of our clients are able to use insurance-covered, commercially available bioidentical hormones, while others choose cash-pay compounded options that remain affordable and allow for greater dosing and delivery flexibility. Because hormone needs are highly individual, we do not use a one-size-fits-all prescribing approach. Every prescription decision is tailored to the client's symptoms, labs, response to treatment, and personal preferences, ensuring care that is both clinically appropriate and financially considerate. Compounding pharmacies play a vital role in creating customized hormone prescriptions. They ensure you receive the exact dosage and combination needed for your treatment. Progesterone, estrogen, testosterone, and DHEA each play unique roles in your body. Understanding how to use them effectively can help manage deficiencies and excesses, ensuring balanced hormone levels. Cortisol and thyroid imbalances can cause fatigue, weight changes, and mood issues. Identifying these symptoms early allows for targeted treatment options to restore balance. Lifestyle changes such as stress management and diet play a significant role in managing cortisol and thyroid issues. These adjustments can complement medical treatments for better outcomes. Insulin resistance is linked to weight gain and fatigue. Understanding its causes, such as diet and lifestyle, is key to improving insulin sensitivity and overall health. Dietary changes, exercise, and supplements can significantly improve insulin sensitivity. These strategies, combined with medical guidance, help manage insulin resistance effectively. Supplements play a crucial role in hormone balance. They support your treatment plan and help maintain long-term health. Expect to see results within a few months of starting your regimen. When you work with us at Vitality Collective, you are guided through a clear, thoughtful, 6-step process designed to support real, sustainable hormone balance. We start by listening and by believing your lived experience. You are not a collection of symptoms to us. You are a whole person, and your care reflects that. We are not a menopause or hormone factory, and we do not offer cookie-cutter prescriptions based on online forms. Our work is intentional, individualized, and rooted in relationship. At Vitality Collective, our commitment is simple: to walk alongside you, help you reconnect with your spark, and support your return to vitality, body, mind, and spirit. Ongoing support and monitoring are essential for long-term hormone health, and how we work with you depends on where you live. If you reside in Massachusetts or New Hampshire or can make the trip to see us, you may establish a formal client-patient relationship with our licensed medical provider, allowing us to support your ongoing hormone care in accordance with state licensure guidelines. If you live outside these states, we can still support you through hormone health coaching and education. In this coaching-based model, we do not diagnose or prescribe, but instead we review symptoms, patterns, and comprehensive questionnaires. We can help you access specialized hormone testing that is shipped directly to your home, and we provide educational insight and personalized wellness recommendations based on your results. This approach allows us to share our expertise, support hormone balance, and help you make informed decisions while encouraging collaboration with your local medical provider when appropriate. We look forward to supporting you on your journey. Reach out to us and book a free discovery call at 844-662-3288 or connect with us online at vitalitycollectivehormonehealth.com. We are excited to support you and give the care and information you deserve.